Welcome, everyone. This is Neil Horan from the TA Network, and we're very excited that we have so many folks who have joined us. Puts a lot more pressure on us than we thought we would have, but we're willing to accept that pressure. As many of you know, we have this early childhood learning community that we've always had open for folks who are current grantees, folks who used to have a grant, folks who want to get a grant, folks who just like listening to me once a month. Thanks, Mom. I appreciate you being on the call. So a while back, the folks from the Children's Mental Health Initiative evaluation team said that they wanted to do some sort of calls or community practice calls. And we said, well, we're all friends. Let's work together. And by work together, I mean that they did all the work and I just sort of start the thing off. But so we decided to work together to put together at least these two calls this month and next month, so folks have an opportunity to hear a bit more from your evaluation folks, to talk to one another about this. I want to start out by saying if you are not currently an early childhood focused system of care grantee, it's okay, stay on. We are going to be talking about tools that folks use both for the national evaluation as well as other tools that folks might use in their local evaluation. So you'll get to hear a lot about sort of how folks are evaluating their sites. It's obviously focused on those system of care grantees that currently have a grant focused on young children and their families. But we just wanted to sort of say that up front so that you're not surprised when we spend a good amount of time talking about the national evaluation. So this is the first. We're going to do another one, and we'll talk about this in a bit, but another call jointly in June, and we will talk a bit more about what that's going to entail as we move along. We always like to have a disclaimer, which apparently throws Georgetown under the bus, it looks like, if you read it carefully. Oh, no, it doesn't. It just says that it's our presentation, not reflective of anybody else's information. But I want to just talk through a bit here that these are our views and opinions, and it's not necessarily the opinions or doesn't reflect Center for Mental Health Services or SAMHSA or HHS. And as all of you hopefully know, we're all funded by those folks, so we want to make sure that we are providing accurate information, but we're the ones who came up with all the content. So we are super excited to have all of you on here. We encourage you to use the chat function, ask questions, and sort of get from this call and this discussion, and we hope it's going to be a discussion, a good sense of the early childhood tools for the national evaluation. We will spend some time really having a presentation from the team, talking, make it as interactive as we can. We'll do some questions. We'll facilitate a bit of a discussion. And again, along the way, as we're going through this, if there are things that are pressing, please don't hesitate to sort of put them in the chat box so you don't have to wait until there's a question and answer period. But we encourage folks to sort of use lots of different mediums in order to make it as interactive as possible. The bulk of our time is really going to be with the National Evaluation team, and I want to introduce them. We're really lucky to have three members of the National Evaluation team. We have Abram Roseblatt, Liz Quinn, and Prithi George. And Abram, Liz, and Prithi have spent a lot of time, obviously, working on thinking through this piece around how the early childhood folks address the national evaluation, what tools, how relevant can these be. And so I'm going to turn it over to Prithi, and Prithi is going to sort of take you through the next section of this call.
Great. Thank you so much, Neil. We really appreciate the introduction, and we really are excited to speak to all of you about these early childhood tools and about the work that you're doing in your own systems of care. My name is Prithi George, and I'm a member of the National Evaluation Team, and I'm joined here by Abram Rosenblatt, who's the project director.
Hi, everyone.
So what we're going to do first is just spend most of the time on a few slides talking about the early childhood tools, specifically those that are going to be used in the national evaluation. And first, though, we'll give a little bit of an overview of the national evaluation before we go into the tools, for those of you who may not have worked with us in the past. So before we get started, I just wanted to do a little bit of a polling question just so that we get a sense of the folks that are on the call. Our first question is about please indicate which option best applies to you. Are you a currently funded System of Care expansion grantee that's funded in 2013, 2014, 2015, 2016, or 2017? Or are you a previously funded System of Care grantee funded before 2013? Or do you fall into the other category? Or no, I don't know. So we'll just give this a couple of minutes just to load up. It looks like, yeah, that's great. So most of the folks on the call looks like are current System of Care expansion grantees that have been funded in 2013 or afterwards. And those of you who have been funded previously or who may have other roles within your own systems, we appreciate you listening in on this call, and we hope it'll be helpful for you too. We have one other polling question. Has your grant, if you're part of a System of Care grantee, have you submitted data for the Child and Family Outcomes Study data to the national evaluation before? Great. Okay, so the majority of folks have not submitted data. That's helpful for us to know so we can sort of prioritize how we talk about the data and what kinds of information we share. Thank you all so much for participating in those poll questions. That's really helpful. Okay, so great. So like Neil just mentioned, we'll be talking mostly about our tools that are in the national evaluation. And after we go through some of these slides that are specifically about these early childhood tools, we'll have a short question and answer session. And if you have specific questions about any of the content we present in these next few slides, Abram is going to be facilitating that question and answer session. And then afterwards, Neil will go through and do a more broader discussion about early childhood tools that are used in early childhood systems of care. So first, for those of you who may not have been involved with the national evaluation before, we are the national evaluation team. We are the national evaluators that were funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. We are the evaluators for all the System of Care expansion grantees. And SAMHSA has awarded this evaluation contract to WestStat, with whom Abram, Liz, and I are affiliated. WestStat is a private research organization that's based in Rockville, Maryland. And we have partners at a number of different organizations who work with us to carry out the national evaluations efforts. Those partners that we have include folks like Youth Move National, the Federation of Families, FREDLA, WRMA. And so we are working as a team to understand systems of care and the implementation of your systems of care. So one of the major components of the national evaluation, there's many different components. We're interested in understanding how systems of care are implemented, expanded, and sustained. And one of the components, so there's many different levels of the national evaluation, but one of them in particular, the one we're going to talk about today, is we are interested in understanding how children, youth, young adults, and families are doing in systems of care while they're receiving services. So the Child and Family Outcomes Study component is the part of the national evaluation that is specifically looking at how youth and families are functioning over time while they're receiving services. So we, at the national evaluation, we currently have tools, instruments for children, youth, young adults, and caregivers. And currently, the age ranges that we have for individuals who are receiving services that are eligible to participate in the national evaluation are individuals who are ages 5 to 21 years old. But what we are interested in doing is expanding that age range to include more young adults at the upper end, but also include an early childhood component so that we can include individual children who are ages 0 to 4 who are receiving services through systems of care. And so that is what we are going to be focusing on today. Currently, we have 3 specific early childhood tools, which we'll talk about more in depth in just a moment, that we are proposing to be used for early childhood systems of care or systems of care that include that younger age range. Now, right now, those tools are being proposed, are submitted to the Office of Management and Budget. And the Office of Management and Budget, or OMB, is the federal organization, the federal agency that is in charge or will provide approval for any new data collection efforts that we do with federal grantees. And so right now, those tools that we're going to be talking about are under review at OMB. So all of this collection of these instruments is contingent upon receiving that approval. So we are waiting to hear back, and we anticipate hearing back at some point soon, but we are sort of waiting. It's up to them to let us know when those might be approved. So just so you know, that's where we are. And let's spend a little bit of time talking about these tools that we proposed. So, so how are data going to be collected about children who are ages 0 to 4? So the way that the national evaluation is structured for this child and family outcome study component is that grantees will have interviewers who will interview caregivers whose children are receiving services using the child and family outcome instruments. So we'll have caregiver reports of information about those children, and then we also will have background data from administrative records also submitted to the national evaluation. And so right now, here's just a list of the different tools. So you'll notice at the very bottom, like I mentioned before, we have tools that are approved for anybody who's age 5 and older. And those are the instruments that we currently have approval for and we're currently collecting data on. What we're waiting for OMB approval on are the early childhood tools. And these are the ones that we're going to be speaking about specifically today. The one for 1 to 17-month-olds includes the baby pediatric symptom checklist, the BITSEA, as well as the caregiver strain questionnaire and administrative data, like I mentioned. And then for children who are ages 18 months to 4 years and 11 months, we have the preschool pediatric symptom checklist, as well as the BITSEA, and of course the caregiver strain questionnaire and the administrative data section. So what we're going to talk about specifically are those early childhood tools. Now for anybody who has questions about these other instruments, we have materials and presentations that we've done in the past about these other approved tools. So please let us know if you'd like any of that information, because we can certainly send you PowerPoint slides or recordings for previous presentations we've done about those. But we'll focus on these early childhood tools right now. So the first new tool for early childhood is the Brief Infant-Toddler Social and Emotional Assessment, or the BITSEA. So essentially the BITSEA is a brief screening tool that captures social and emotional items for children ages 0 to 4 years and 11 months. That's the age range that we're asking for grantees to collect about for youth that are in the national evaluation. So there's 44 items on the BITSEA. It has a 3-point scale for all the items, and it takes about 7 to 10 minutes to complete. The thing about the BITSEA is that it is a proprietary measure, so we can't actually display it for you here because of that nature of that. There are some other sort of logistics that we can talk through, but we'll talk through those more specifically once we get OMB approval. So that is one tool. The other tool that I mentioned before is the baby's pediatric symptom checklist. And this is also a very brief social and emotional screening instrument. It can be used for children who are ages 1 month to 17 months, 31 days. So there's 12 items on this particular instrument. Each item is rated on a 3-point scale. It's very short, and it takes less than 3 minutes to complete. It's a non-proprietary, publicly available measure, and if you'll notice that in the files for download with this presentation, the baby pediatric symptom checklist, you can just download it actually right here. So there's also a link at the bottom where you can go to a copy of that instrument and take a look at it if you'd like to. So then for the slightly older children, so for children who are ages 18 months to 60 months, we have the Preschool Pediatric Symptom Checklist. This is also in the same Pediatric Symptom Checklist array for different age groups. This is a social-emotional screening tool, and it can be used. It specifies on the tool that it can go up to 65 months, but for the national evaluation, we're asking the age range to be 18 months to 60 months. We have another tool called the Pediatric Symptom Checklist that's used for individuals who are 60 months and above. So it's 18 items. There's a 3-point scale for all the items, and it's also very, very short. It takes 3 minutes to finish, and it's also publicly available, and you can actually download it here from the slide presentation as well if you'd like to see it. So those are the main tools, the 3 early childhood tools that we are proposing to use in the national evaluation once we get OMB approval. Now, so just so that you know, if you are a currently funded grantee, we will let you know once OMB approval is received. And so no data collection on these instruments is actually happening right now. We have to wait until we get that approval, and once we do, we'll have a whole process to orient you to how the tools will be collected and more information about that. So you'll have fair warning about when any data collection needs to occur. Great. So just a brief overview of how often this information is collected. So all child and family data for any age individual is collected at up to 3 time points. So we have baseline interviews, and then we also have 6-month follow-up interviews, and we also have 12-month follow-up interviews or discharge interviews, whichever ones come first. So a maximum of 3 time points. So who can participate in the Child and Family Outcome Study? So essentially, the goal is to collect data on any individuals who are eligible and consenting caregivers. We understand that there's a lot of variability across sites in terms of how many people you're currently serving or how many people you plan to serve. And so we don't have a target goal for sites in terms of the number of children we want enrolled in the Child and Family Outcome Study. But we just ask you to collect information on as many eligible and consenting caregivers who are receiving services at your site. So in terms of appropriate respondents, we have the caregiver is going to be the only respondent for these early childhood tools. And the caregiver can be a primary caregiver is essentially anybody who is knowledgeable about the child and can provide information about their functioning and well-being. So this could be, for example, a family member or relative, a biological adoptive or foster parent, or someone else who knows the child well. And a caregiver can change over time. So, for example, if you have one caregiver at the baseline interview, you could have a different one at the 6-month or 12-month interview. And the person who's responding to those questions does not necessarily have to be the legal does not have to have custody of the child, but whoever is responding, we need to have consent from the legal guardian in order for that person to report on the child. And one caregiver respondent is included in the data collection interview at a time. So we wouldn't interview more than one person at a time for any one child during one interview. So this is just a sample example of the enrollment process into the Child and Family Outcome Study for the National Evaluation. We know that this may not always be how everything falls into place depending on how your system operates, but this is just one example. So if you have a child that's referred to your system for services, you would determine whether or not they're eligible for services, and if they are, you would introduce the Child and Family Outcome Study to them and determine whether the family is interested and see whether the caregiver provides consent, and if so, then you could conduct an interview and gather that information. So baseline interviews, in terms of target dates, we suggest to grantees that the baseline interview occur within 30 days of when initial treatment services begin. So that's a general estimate of time that we're recommending for grantees in terms of data collection. And then in terms of the follow-up, so the 6-month interviews and the 12-month interviews, those dates are determined by when that baseline date occurs. So it would be 6 months after the baseline interview. You would have 30 days before and 30 days after that particular date in order for the follow-up interview to occur. And the discharge interview would be conducted if a child leaves care before the follow-up date happens for the 12-month or the 6 months. Now, we understand that there may be children who you're already serving in your systems of care who you may not be collecting data on because you currently don't have approval. So that is totally fine. So for children who are already receiving services in your system, you could, once we receive OMB approval for these early childhood tools, you could do a baseline interview with them the next time your project has contact with that caregiver. And so we understand that that may not be a true baseline because that's not when they actually started services, but that's totally fine because we can account for those in our analyses. And we can account for that because we'll have the start of services date. So we'll be able to track that when we look at the data. And in terms of the submission of data, so for those of you who have not submitted data to us in the past, the way that the Child and Family Outcome Study data are submitted is through our CMHI portal. So the CMHI portal is a website that grantees can access to enter child and family data for the national evaluation. And so for all of you who will be involved with this, we'll have a training that specifically goes through how to access the portal and how to enter your data through that system. But that would be the system that you would use to submit your early childhood instruments. So in terms of the other specific types of questions, this is just a question that we've received from other grantees. If a child is in the custody of the state, is there a caregiver interview that staff need to complete for the child? And we do not have staff who are interviewed as caregivers as part of this national evaluation. If a child is in state custody but has a caregiver who knows them well enough to respond to those questions, then that caregiver could participate, as long as whoever has legal custody and the legal authority over the child provides consent for that participation to occur. Oops. Here we go. So in terms of grantee support, just so that you know, for those of you who are currently system of care grantees, you probably have been involved with your evaluation liaison. Those of you who may not be yet submitting data to us, each grantee who is a system of care grantee, who's part of the national evaluation, of course, will be assigned a grantee evaluation liaison as your point person, your go-to person for any questions. And so if you have questions about the data that you're submitting, you can ask your evaluation liaison, or you can always ask questions of the CMHI help desk, which is cmhieval@lestat.com. And that is a global email box that will go to the National Evaluation Team, and people will give you a response within a short turnaround. Okay. So those are the content slides that I had to present about the early childhood tools. I just wanted to pause for a moment and just see whether there are any questions. I know that there's quite a few questions that have been coming through, and I wanted to just give folks a chance to get those answered. So Abram, do you want to facilitate this piece? If you have questions specifically about any of the tools or content that we've just talked about so far, we can go through those at this time.
Sure. So folks would like to type in any questions they may have, we can go ahead and give you some verbal responses. We've been trying to respond as you've sent in questions as we've gone along. I had a feeling that was going to come up, the difference between this and NOMS. So NOMS is the National Outcome Measurement System. It is collected by SAMHSA and by a contractor to SAMHSA for most of the SAMHSA grant programs, and then there are also specific questions that are associated with specific SAMHSA grant programs. NOMS does have information on who is served, on the characteristics of young people served, in this case young people, and on SAMHSA grant recipients, as well as some outcome information. The data that we collect for the CMHI national evaluation is separate from that, so that's important, and it is in addition, and I'll say a thing or two about that in a second. And it is focused specifically for CMHI grantees. There are items that are not part of NOMS that are important for our grant program, and so that's why we have these questionnaires. The other thing I will say about the relationship between CMHI and NOMS and the CMHI National Evaluation data is that there is very little overlap between the two, and we've done that on purpose. We didn't want you to have to enter the same information twice, and so while there's a bit of an overlap so that we're able to link records with NOMS, they are different measures. And rest assured, we will be using NOMS data through a data use agreement with the organization that collects NOMS data to allow us to merge that with the national evaluation data. So this is a combined effort where the data you enter for NOMS will also be used for the national evaluation, and then we have these specific tools. One other thing about the tools is we've tried to pick ones that are as brief as possible in order for you to be able to do your own local evaluation and also for you to be able to complete the NOMS. So we've tried to keep this both coordinated with the NOMS and as straightforward as possible, and as you can see from Preeti's presentation, we've also picked young tools for the 0 to 5 population that, where possible, mirror the tools that were used for our older population. So the Pediatric Symptom Checklist, the preschool, and the baby versions are all from the same family of tools. So that's our basic rationale there between the NOMS and the CMHI National Evaluation. The last thing I'll say is WESTAT cannot talk about NOMS present tools. We can talk about them, but we're not here to answer your questions about that. We don't collect that data, and so we'd ask you to direct those to the folks who collect the data for NOMS. But we're happy to answer all your CMHI eval questions and try and help you with the relationship between the two.
Okay, while folks are thinking about questions they might have for our guest presenters today, we're going to go ahead and we're going to unmute the telephone line. So if you have a question that you want to ask directly over the phone, you can do that. Two things to keep in mind. When I unmute the lines, if you hear an echo effect, mute your computer speakers because you're having dual audio, and that's what's causing the echo effect. And we do ask that you self-mute your line so that we can limit any audio issues. Thank you.
Since you don't have OMB approval yet, when that is obtained, will the data have to be entered retroactively?
No. Thanks, Beth, for that question. I think I recognize that voice. And the answer is no, we won't ask you to enter data retroactively. We will start up data collection just as soon as we have OMB approval to do so. In fact, we'll be ready to get going within 30 days of OMB approval. But one other thing I will add, many of you, if you are participating in a CMHI grant program and you have NOMS requirements, please enter those data. Those are already OMB approved. You'll have some instructions about that from SAMHSA, from your GPOs, and from the contractor for those data. So please do enter those.
It's Beth again. Another question is that if a site is focusing on early childhood, are there other national evaluation instruments that they should be using now in advance of when the ones you've just described become approved by OMB?
Not really, Beth, because we need OMB approval for all of our tools before we can implement them. So we do ask that you all complete your NOMS data because that will feed into the national evaluation, so we won't completely lose information, so please do that. If you'd like to hear our recommendations for things for local evaluation, we're happy to provide those or talk with you about your local evaluation if they're one of the grantees that work with us, but we can't ask any of you to collect any specific national evaluation data until we have OMB approval. In the event we don't receive that approval or they ask for modifications or changes, which is always possible.
However, if you are an early childhood site that's serving 5-year-olds, you can use the Pediatric Symptom Checklist as well as the Columbia Impairment Scale and the Caregiver Strain Questionnaire. Those tools are already currently approved for 5-year-olds or anybody who's 5-year-old and up to 21-year-olds. So those age ranges are approved at this time.
You all are impressively quiet for being unmuted with 60 people on the line.
Yeah.
It's very intimidating, Abram. So
Yeah.
I wonder if we want to just move. We have a couple other questions that we could sort of throw out to folks, and maybe you all would be willing to sort of jump in here. And folks, you're not required to sort of call out questions. You can type them in, or you can sort of let Beth have every single question that she wants to ask of Abram, since I'll never talk to her again. So let's talk through this a little bit, because it would be interesting just to hear from folks if you're using any of these tools. I mean, I think that you know, obviously some folks who've been focused on early childhood, those of you who have these grants, you know, we're really interested in both whether you're using these tools and other tools that you're using. I can see the list of who's on the call, so I could call on you because I know some of you, and some of you are in my office, Deb Perry, but some of you you know, you could sort of throw out like what you're doing. So maybe we could start with this first one, and since we have, you know, Liz and Preeti and Abram, they could sort of jump in here. But are any of you already using some of these tools in the work that you're doing? So I see some folks are typing, which is always lets me vamp a little bit, but we appreciate it. So, you know, we are interested to sort of see if you're using these tools. I see Richard from Florida is using the BITSEA. I see a couple other folks are typing. Deb in DC, you're not using those tools. So I do want to sort of sit with this question for a little bit, because I think we're going to have lots to talk about with the other early childhood tools. So Natasha's using the Ages and Stages Questionnaire, Social Emotional, Parent Stress Index, and the PHQ-9. All right, so I see folks sort of using some of these other measures as well.
I'll add one thing while we're getting these. These are really interesting on the BITSEA. it is proprietary. It does come with a cost. We are working with the publishers of the BITSEA to develop how that will get paid for if we're approved to do it, but we do not anticipate there being any cost for grantees. We will cover whatever costs there are for implementing the BITSEA.
That's great. So you see folks in Michigan and Ohio are using the DECA. So I see a number of folks using sort of the kinds of screening tools we oftentimes find in the early care and education world. A couple other folks are still typing. Natasha was
I've got
a
question while folks are typing. Can you hear me?
Yeah, just tell us who you are and where you're from. Maybe.
Oh, okay. My name's Becca Sanders in Michigan, and I don't know if this might be too vague it's just sort of a fodder to chat about. One of the sort of tricky bits on the early childhood instrumentation, and I think it's because I just don't know a ton about it, is when you're trying to do longitudinal, because the instrument versions switch so much, you end up, like some items line up and some don't, and so I'm just wondering, A, how that works with the pediatric symptom checklist, and then the other thing is we seem to take screeners and then use them longitudinally. I'm just wondering kind of what the literature has to say about that, if you have any insights on that. We kind of turn them into like longitudinal outcome measures.
Well, those are great questions, and I bet other people can address that too, but I'll take a shot at it since I think that's something that falls in my job description somewhere. Those are fantastic questions. And actually, it is true. The Pediatric Symptom Checklist was originally developed as a screener, but it has then been tested as an outcome measure. And so that was part of the decision-making process when the National Evaluation decided to use it. As it turns out, the screeners tend to be short because they're screeners. And so when they're able to be used for outcomes, it works well, and they also can work for multiple purposes because you can use them as an outcome tool and as a screener. So there are some advantages to the screeners. It is also true, however, that you don't get as much depth of information as you do with some of the longer tools that we're probably all familiar with that will give you broader amounts of information. Again, for us on the national evaluation side, we wouldn't want to say that these are certainly the absolute best or only tools. They're the ones that sort of fit the parameters we were looking for, which was they complemented the NOMs. They asked things that aren't already in the NOMs. They are generally free. We had to go with the BITSEA because we couldn't find an equivalent that was also free, and they're very brief. So that was kind of our structure, and that's kind of, I think, the first part of your question. The other one is, yes, it's very hard with these tools that change. I have always really liked using the ages and stages historically, and as many of you know, that changes very rapidly because the developmental process for the really young children, and there always were challenges there, and you kind of ended up going with things like what proportion of goals were achieved or whatever for each age group. That's also true for these pediatric symptom checklist measures that do change with them. We're generally trying to stay with the measure you start with. We don't have long time frames, and so there aren't enormous amounts of young people who are likely, or young kids who are likely to switch over from one to the next. But when we do have that happen, we're going to have to think a little bit about how to treat that, and that depends on the kind of analysis we end up doing. And if I start talking about that, it'll probably bore all of you to death, and I see more people have questions. So I'll stop at that point, and we'll see if we get some more participation.
So this is Neil, and Abram and your folks there. You'll see that folks are sort of throwing out a number of different tools that they're using, and some of them obviously are sort of consistent across a number of sites. I see Becca and Deborah are talking about what they're using in Michigan and D.C. We do have a question from Becca around the PPSC in terms of an outcome tool. I mean, I think, Becca, that the question is really important in terms of what are we trying to do? What is the national evaluation trying to accomplish, and what are you trying to accomplish at a local level in terms of your use of local sort of measures? And I think that it's always a delicate balance so that the burden's not too heavy in terms of the national evaluation. and that there's data sort of collected at the local level that can drive your system. And I think that you have a number of evaluators on here, and I think it's a good question to sort of hear back from some of the folks who may not be sharing necessarily what tools you're using, but sort of your thoughts in terms of how what are you using the data for? What is it that you're trying to do in terms of changing your system, helping to develop supports, and sort of whatever it is that you're trying to do in your system. And that sort of gets at these two questions that are here at the bottom in terms of challenges and solutions. But, I can tell you from experience from the previously funded sites that a number of them really saw their local evaluation as a means of sort of driving their unique systems, be it Los Angeles or Alamance County, North Carolina, or wherever those grantees were, while also using that national evaluation sort of data as a platform to sort of discuss what are we trying to do nationally. And so I think that's the balance there. But in terms of the question that Becca has, of course, I give it back to Preeti, Liz, and Abram in terms of sort of how you're using the outcome tools.
I see the note about sharing the lit. Yes, we'll be happy to share the literature on that, on the PSD for an outcome tool. It was actually something when I first got here, I've been here a couple of years, that I asked for because I was trying to learn about that myself, because I always use it as a screener. So we'll definitely be happy to share that with you.
That's great. Thanks so much. That saves a lot of time.
Thank you.
So the other thing that folks, this is Neil again, the other thing that folks may want to do is if you're seeing things here in the chat that you're not familiar with, this is a great place. We're early childhood people, so we're all touchy-feely and care about each other and want to help. So if there are tools here that you're seeing, you're like, I don't know what that stands for, or can you tell me a little bit more about that? This is a great time because I think it's a forum where you really can learn about tools that maybe you're not as familiar with. And there's certainly some here that I think most of us are, and there are some on here that I'm looking at that may be sort of new to folks. So if you have questions about that, feel free to sort of just type in, what's that one? And then we'll sort of see what kind of responses we can get for that. And not surprisingly, my friend Richard from Florida, Johnny on the Spot, all kinds of resources for you in terms of some of the work that's been done out there. So for those of you who've been using, whether it's the ASQ or the XE, the CANS, what's sort of your experience, both in terms of any of the tools that you're using, that you've used that are part of the national evaluation, as well as those tools that are sort of more unique to your local evaluation? What's your experience in terms of families' willingness to caregivers' willingness to fill that out? And sort of maybe some of the things that go well, the things that are challenges. If folks would be willing to share, that would be, I think, super helpful for those who are less familiar or who have not done as much work in the early childhood realm. I said that out loud, right, Abram? I just want to make sure that everybody
heard. We heard you for sure.
Okay. Yeah, no, I just want to make sure, when it's interactive, sometimes the things that I'm just saying that. Yeah. All right, I see some folks are typing.
One other comment is I'm seeing some of these tools come up. We're quite familiar with many of these tools. I know personally I am, and have used them. One of the things that we'll be happy to work with you all on, those of you who are CMHI-funded grantees, as you go forward, is if you're using some of these tools that we're familiar with at least, we'll be happy to talk with you about how to think about integrating the national data collection measures with whatever measures you're collecting locally, both in terms of doing something pragmatically with them and also analytically and those kinds of things. So you know you're all doing really good work with your local areas, and we don't want to get in the way of that. And to the degree possible, we'd like to be able to help you integrate if you're not currently using the measures we're using. We see a lot of typing going on, don't we, Neil?
Yeah. Let's let folks sort of type it through. Beth Stroll is going to just keep calling on someone until they respond to her, so you got to respond to her. She's not going to let you go. I'm just telling you from experience. Because if you don't answer, she's going to call on me, and that's going to be the worst thing. So, thank you, Natasha. So, there's a question directed to you, Natasha, but it's sort of a more general one, and Abram, to you and your team as well, in terms of tools that really do make sense in terms of they've already been translated and normed and validated versus ones that haven't, and how folks are sort of addressing that so that these tools are linguistically relevant for the folks that you're using them with. And just a helpful tip before you answer that, folks, if you don't want to answer, apparently all you do is you type in listen only mode. Apparently that means I'm not going to answer.
Yeah, we will, the measures we have do have various language translations, and we'll certainly provide those to you. You can access them on your own, but we'll make sure you have them. The very small amount of additional information that we have, we translate into Spanish. Unfortunately, we don't have resources to translate them more broadly. Although one of the things that we're going to be doing with the national evaluation is, if you are participating with us, we will have a SharePoint site for all of you, and you'll be able to both get materials from us and also ask for materials from other grantees. So if other folks have different language versions, I know in my years in California, we had, for example, many versions of Spanish tools that we would use in different communities based on the community. So we definitely are very aware that that's often the case, that one certain language translation, while better than not having it, may not be really particularly tailored to a specific community.
Well, this is Neil, and while folks are typing, I will say on another project that I'm running, we had to translate several protocols around early childhood mental health into Cantonese and Spanish. And one of the things that we ran into is that there were plenty of folks who were willing to do the translation for us. They were not necessarily folks who actually understood the concepts that we were trying to get at. And so we actually had to go into the communities that we're going to use these protocols in and find the folks who were traditionally doing the translation, doing the interpretation services, to ensure that there were folks who were familiar with these concepts. And I'm sure that's probably not news to anyone on the call, because you do this all the time. But for me, it was a very interesting exercise that there's a big difference between being able to translate something into another language and being able to translate what are, I think, very tough concepts to translate into different languages when we talk about very early childhood social emotional development. So I think it's something, Natasha, I'm glad you brought this point up, because I think that this is something that we all need to be thinking about, given sort of the wide range of folks that we're all working with and the translation issues and just in general sort of the concepts in social emotional development.
Oh, there's a comment here that I have to read. National Evaluation has done a great job trying to reduce respondent burden to grantees. Becca, you're fantastic.
Thanks, Becca.
Becca, you can join
yeah, good job.
from now on.
We appreciate it.
Did you plan her, Abram? Just put her in the audience.
I'm going to now.
Well, you just think about the old days, right? Like it's just, it's much, much more doable. So we appreciate it.
Yes.
We remember the old
We
days.
remember the old days, both Preeti and I,
Right.
as local evaluators. So. It looks like, Natasha, from your comment, the timing of your tools will match ours. So that's maybe helpful for you if you're participating with us.
That's a great place to catch people in pediatric primary care settings to help do those screenings. Certainly a place where they will be.
Okay, so this is Neil. I don't know if there are other sorts of questions, comments, issues that folks have. We're not required to sort of just sit here in silence until somebody asks a question. We just want to make sure that, you take this opportunity. There will be another call in June where we'll have a chance, but we also want to make sure not only are you familiar with sort of the tools that are going to be used, but this is a broader conversation about sort of how you go about using this evaluation data. So if there are other sorts of aspects of this that you want to take advantage of the fact that the team is on, please feel free to sort of jump in there.
I think, Neil, I think we're probably going to wrap it up if we're at that point. Is that right? Folks can have time back. I'll let you finish up, Neil, but just before we sort of sign off on the WestStat side of things, I just want to thank my colleagues here at WestStat, Liz and Preeti, for putting a lot of work into this presentation and for working on this. And I also want to invite all of you who will be working with us to ask your questions directly of us at our cmhieval.org website. For those of you who are not working with us, we hope to work with you sometime soon, but unfortunately our scope is such that we can't work with you if you're not a current grantee, but we hope that you will be soon if you're not. And for the rest of you, we hope to see you as you work through this process. We hope to have many of you on our next call on this topic. Neil, if you want to take it from there.
Thanks, Adrian. Yeah, so that is an important thing to keep in mind is that, so I know some of you may not be a current grantee and are like, those sound like good people to be able to talk to. Obviously, their scope is limited. Mine is less limited in that, as part of the TA network, we want to support all the folks who are trying to build up their early childhood systems. Obviously, we are focused a bit on those who have the grants, but I'm available, as is the rest of our TA network team, to be of as much support as possible. We appreciate, when we started talking about this, with the WestStat team, we really wanted to have a time and not just a quick sort of one-time thing, but at least put two, and if there's a reason to do more, that we've all talked about doing this more often, but to put a couple of sessions together for you all on a monthly basis, have a chance to sort of talk through some of the issues. So this month obviously focused a bit on the specific measures and the process. Next month to talk a bit more about sort of policy systems and services, so it'll be a bit broader conversation. We hope that you'll join us again, as Abram and his team has mentioned several times. If you are a grantee, you have specific questions, please reach out. Don't sort of wait for us to have an hour and a half long webinar, but we hope they'll see you in June. We'll try and have another special guest and start the party right. And then if there's other questions, please feel free to get in touch with us. We appreciate everybody's contributions, questions, comments on here, and we'll keep the conversation going next month. So thanks, everybody, and we'll talk to you next month.